Hello and welcome to my talk on Scalp acupuncture in stroke-related aphasia. I am Dr. Scott Whitfield, licensed acupuncturist, doctor of acupuncture and oriental medicine, and I am also certified in Zhu's scalp acupuncture system. There is no Western or Eastern medicine, just one human medicine, is one of my favorite Dr. Zhu quotes. Introduction. I worked with and apprenticed under Dr. Ming-Ching Zhu, Dr. Moyee Siu, and Dr. James Liu at Zhu's Neuroacupuncture and Rehabilitation Center when it was located on Technology Drive in San Jose, California. This was around 2015 through about 2017. During that time, I took a case which required home visits for the patient. There will be 4 parts to this talk. First, we'll discuss the patient, then the diagnosis. Thirdly, we'll discuss the treatment and plan. And fourthly, we'll discuss the case in general and bring it to a conclusion. Let's talk about the patient. The patient presents as an 89-year-old male with aphasia and cognitive deficits due to a recent embolic stroke secondary to atrial fibrillation. He's located in Piedmont, California. He's a retired gentleman, and he's been married since 1959. Present case history. This was given verbally to the provider by the patient's daughter. On December 3rd, 2016, the patient was hospitalized with a large left temporal embolic stroke, which also featured some hemorrhaging. No allopathic interventions were performed. The patient can sit up in bed, stand, walk, and is generally alert and responsive. The patient's speech and cognition seem to be most affected by the stroke. He clearly exudes aphasia, but can enunciate words properly. He has difficulty understanding phrases spoken to him and makes up nonsensical words when he can't come up with the right word needed to complete his thought. This is frustrating to the patient, and he led an intellectually stimulating life before his stroke. He expresses his frustration with this situation by reverting to a form of faux French, including some actual French words, but more commonly gibberish which sounds French. The patient has control of his limbs and can write a little. His daughter, who is here from out of town to help coordinate her father's care, reports progressive improvements in the days following the stroke. She has also noticed that his right eye wanders laterally. She states more words are coming back on a daily basis and that he's slowly regaining control over his urination function. Other home health providers visiting him these days include a physical therapist, a speech therapist, a massage therapist, nurses, and personal assistants. Lastly, the patient will be receiving 2 times a week radiation therapy for prostate cancer starting on December 26, 2016. Current and past medical concerns. This patient has prostate cancer, a frozen shoulder on the left side, left middle finger pain due to a botched injection, hemochromatosis, chronic anemia, chronic lymphocytic leukemia, chronic left ankle pain, right knee partial replacement surgery, osteoarthritis of both knees, diabetes type 2, hypertension, atrial fibrillation, and heart murmur. Let's call this patient Sandy. His personal history is as follows. He was born in Glasgow, Scotland in 1928. He, in 1950, graduates from Harvard Business School. He receives awards for philanthropy and education in 1995. And in 2016, he suffered his stroke. So he was deeply involved with the University of Edmonton. He flew for Canada in World War II. He had a very adventurous and intellectually stimulating life. He gave away millions of dollars in Chinese art and real estate to the University of Edmonton, and he just had a really interesting life. And by the time I met him, he couldn't express any of those things, really, which was leading to a lot of frustration. So at the initial visit, I took a physical examination of this patient and collected the following data. His Shen looked good this day. Good Shen, bright, responsive, and his complexion, not too bad for someone who is 89 years old. A little bit slightly dusky white, perhaps, but overall okay. Appearance, he was alert, calm, friendly, cooperative, and well-groomed. His body stature, he's a tall gentleman, frail, thin, kind of bony, and somewhat hunched over, especially in the thoracic area. The patient's tongue was slightly swollen, dusky red body, greasy yellow coat. His pulse on the right side was flooding, on the left side irregularly intermittent and choppy. On listening to this patient, I did not detect any breathing that was audible to my naked ear, and no distinct odors were detected. In addition to pulse palpation, I did palpate the limbs of this patient and found thick bands of darkly mottled skin, which was encircling the patient's lower extremities, and this tissue is hard and taut to the touch. Next up, diagnosis. In Chinese medicine pattern differentiation, the patterns that matter in this case have to do with Zhongfeng wind stroke, mild type pattern, phlegm fire obstructing the channels and collaterals pattern, dual spleen and kidney yang vacuity pattern, also heart blood stasis and lower jiao damp heat. Here are my thoughts on the etiology and pathogenesis in this case. The embolic stroke did not leave the patient severely crippled in terms of physical mobility and function. Therefore, it's the mild type of wind stroke versus a more severe type, which would leave the patient more crippled. The patient is aging, and due to his orthopedic issues, has slowed down physically in his terms of his activity very much over the past decade or two. And his increased sedentary lifestyle led to stagnation of qi and blood. What probably started in midlife as irregular diet and overwork led to spleen qi vacuity, which progressed over time to dual spleen and kidney yang vacuity, ending up as phlegm fire. I'm guessing that this may have occurred after some emotional or intellectual upset, although this is not expressly mentioned in the record. Treatment and plan. The treatment principles used in this case to help this patient were remove obstructions from the channels, subdue wind and resolve phlegm, extinguish fire, invigorate the connecting channels, regulate the circulation of qi and blood in the channels, resolve dampness, drain heat, and nourish the spleen and kidney. The treatment protocol in Zhu scalp acupuncture is multifaceted. We can divide it up into two sections, acupuncture and Daoyin. So under acupuncture, we're going to use scalp acupuncture specifically, but also body and ear points. And then for Daoyin, for this specific patient, we need to customize it, of course. So because he has trouble getting around, mobility is part of it. But mainly, the Daoyin will be focused on speech practice to help improve his aphasia. In terms of Zhu's scalp acupuncture zones used in this case, as you might expect, the following zones were needled: vertex perineum and foot, head and face, upper jiao, middle jiao, and lower jiao zones, the lower limb, and also the right shoulder area. And lastly, auriculotemporal areas were all needled. Most of those big square areas are needled with at least 3 needles in each zone. The lower limb and the shoulder zones are needled usually with 2 needles through and through technique, so needled parallel or in line with each other. That's what I'm trying to say. So for speech training, we're going to start by asking him, tell me a story on the first visit. And then we're going to progress to the use of picture and word cards I'll explain. And with mobility, just getting the qi and blood moving by having the patient get out of bed and walking around will help support the other parts of the treatment as well. So the tool par excellence for retraining people how to speak is using picture word cards. I'll explain. These aphasia tools allow me, the provider, to show the patient a card and say, what is on the card? What is that? And if the patient says apple, as is pictured on the card here, then that's a success. I keep track of how many successes, how many failures, and how many total attempts to try to see if he's getting any better. The treatment plan in this case would involve acupuncture sessions with a frequency of 2 to 3 times per week. The course of treatment would be no less than 10 to 20 sessions, and that's because of the complicated nature of the case, and also how slowly brain problems heal. Lastly, homework would be continued on by the patient and his providers, including speech training and mobility training. Let me provide you with a brief case timeline here. Our first visit was on December 16th, 2016. On around February of 2017, the patient had achieved his personal best on the card identification game, that is, identifying words and pictures on the cards. Also, he developed a complication, a cyst in his scalp during this time, so I had to back off on using a lot of scalp acupuncture while the cyst healed. Lastly, so in the middle there, number 3, we did an assessment report. It was a very positive report. I sent this to his family and his caregivers, expressing my delight with working with the client, but also reporting on his progress that had been made up to that point. Then on March 16th, 2017, there was a crisis. I'll get into that on the next slide. And his last visit was on April 18th, 2017. Okay, let's talk about the crisis that happened on March 16th. So I was planning on doing a house call for this patient that day. It was a Thursday. And the patient's son, who was coordinating the patient's care, called me on my cell phone and said, Scott, Dad has been worse off today. He suffered a TIA or another stroke perhaps, and has been having several seizures well before 10 a.m. So, we've canceled all care for today, and we'd like to cancel your appointment for today if that's okay. And I basically turned around and said, well, sir, if it's all the same to you, this is exactly the time that you need ZSA Scalp acupuncture. This is an opportunity for us to try to turn around your father's life. And by the way, did you know that ZSA Scalp acupuncture could be used in acute situations like this? Is really what it is designed for. So if it's all the same, I was already planning on coming up today to provide your dad with a treatment. So if you wouldn't mind, would you let me come anyway? To which the son said, oh, sure. We just thought it was, we didn't know that it could help. Okay, great. So anyway, I did go up there on Thursday. I gave him a treatment. On Friday, I gave him another treatment. Saturday, Sunday, no. But by the time I got back on Monday, the patient looked as if nothing had happened. So this patient was dying. On Thursday, I could tell the shen was leaving his eyes. He was shenning out and he was in a bad place. But by Monday, after ZSA Scalp acupuncture interventions, he was back again. Section, discussion and conclusion. So what did I learn from this case? I learned that Dr. Xiu's scalp acupuncture system offers a useful approach in post-stroke aphasia. That Xiu's scalp acupuncture techniques can be used to save a life. That some cases of aphasia may take a long course of treatment before results are seen. Lots of Dao Yin practiced by the patient will speed up the recovery process. Best results occur when Dao Yin exercises are performed by the patient at the time of needle stimulation. Choice of Dao Yin exercises matters to the results or the lack thereof. Language is a complex human function, and aphasia has a way of bringing out the bizarre and erratic aspects contained within it. When the limitation of financial constraint is removed, patients and practitioners can move forward decisively to solve life-threatening conditions. And lastly, given the right mindset, resources, and support, almost anything is possible. Was there anything that limited my treatment outcome? Yeah, I think the setback that happened on 3/16/2017 was that major setback that the patient had. But also the inability to needle his scalp and or perform Dao Yin with every treatment session was limiting my treatment outcomes, definitely. And the limits of my own training and skill. I do have a few recommendations to providers finding themselves with cases like this. Gain the trust of the family and the caregivers as quickly as possible. Get the patient very involved with the treatment process from the get-go, doing Dao Yin specifically, especially from the very first session. Encourage the patient to retain needles for as long as possible and to do Dao Yin exercises in between acupuncture sessions. So needles can be retained in the scalp for 2 to 3 days safely. Engage the care staff to assist in your goals for the patient. Practice extreme patience when speaking, when trying to understand a patient with aphasia. And also, just a practical one here, block off enough time on your schedule to be able to get to and from your house call without undue stress. Yeah, I was doing a house call in Piedmont, California, that's near Oakland, from San Jose. So the coordination of that was a bit dicey sometimes. It was the middle of the day, who knows what the traffic is like, had to be there by a certain time. It can get a little hairy. Conclusions. This extraordinary patient was able to make it through some extremely challenging health events while under my care. Because of the concerted efforts of his family, caregivers, and staff, he had an easier time than many other stroke patients might. His medical care was not hindered by financial roadblocks, which allowed for great continuity of care and application of longer-term treatment plans. He also had access to all the appropriate modalities which could possibly move him forward. The thoughtful and systematic approach his family used to coordinate his care is impressive. The treatment frequency and the total number of treatments were optimal in this case. I am particularly gratified that so many long-distance house calls could be delivered so close together and in such large quantities. It is my experience that house call patients rarely can sustain long-term acupuncture house calls due to the high fees associated with such an approach. There are several great advantages to using Siu scalp acupuncture in a case like this. One advantage is the fact that because needles are retained for several hours to several days, they can continue to work for a longer time and have a deeper impact on the patient's condition than removing needles after just 30 to 60 minutes in the clinic. Another advantage is that when the needle stimulation is combined with Dao Yin exercise, the patient is likely to make exponentially better progress than without this targeted, customized approach. Without concomitant patient-specific, results-driven exercises performed by the patient during needling, we are not really doing everything we can to help stroke patients recover as quickly as possible. In retrospect, there was one main thing that I would have done differently. I would have tried to awaken the patient more often and engage him in Dao Yin, conversation, word recognition, etc. as much as possible during each session. I have assessed my own performance in this regard to be in need of improvement. I let the patient rest too often during treatment, and this is a mistake I will be on the lookout for in the future. I consider myself to be extremely lucky to have become trained in Siu scalp acupuncture. Without Dr. Siu's system, I would have had no clue how to go about working on a case such as the one presented here. I am beyond grateful for the experience of having treated this specific patient as well. Doing so has given me incontrovertible proof that Siu scalp acupuncture can work in emergency and severe medical situations. It has also allowed me to touch a life deeply and in helpful, meaningful ways. Prologue. Sandy passed away August 2017 on his ancestral homeland in Scotland. This is where he most wanted to be, and I believe we have Siu scalp acupuncture to thank for helping him get there. Okay, thanks everybody for listening. If you have any questions, because this is a pre-recorded talk, please go ahead and email your questions to scott.witt.11@gmail.com. And if you don't abuse it, you can call me too, or find my website, sagehelpers.com. Anyway, thank you for listening. I hope that you are able to learn something from this. And please go about and use Scalp acupuncture for all the emergency cases you come across in your life. Thank you very much.